Great. Right. Well, thank you all, and welcome to Concussion Legacy Foundation's June 23rd PSV meeting on motivational interviewing. I'm Tyler Ambrose, and I'm the peer support coordinator. If you ever need to get in touch with me, please email me at tambrose@concussionfoundation.org. A brief overview of what we're going to go over today. We have some announcements, then we'll jump into our training on motivational interviewing. We'll jump into some breakout rooms to discuss the training and talk a little bit. Then we'll come to a big group, and then we'll discuss what we've learned, what we talked about, and have some people share. And at the end of our training, we're going to jump into a fun game of Jeopardy where someone can win a prize. As you can see, we have a very big team in patient services, and everyone has such a tremendously great role within this. My name is Tyler, as I've told you 3 times now, and I'm your go-to guy. At any point, if you guys need anything, please reach out to me. I also want to, thank all of you for participating in the mentorship program. Without you, the mentorship program wouldn't exist. You all come from different backgrounds and in different areas. And some of you are former persistent post-concussion symptoms or post-concussion syndrome patients, current and former PPCS caregivers, current caregivers navigating suspected CTE, caregivers who have lost a loved one from CTE, or people who have experienced brain trauma from sports, military, and everyday life. And it's great that we have such a diverse team to work with and help so many great people. So thank you. This training will be recording, so please stay on mute until the end when we jump into our breakout rooms. We have 2 Facebook groups, our CTE resources and our PCS resources. We have 4 main Zoom support groups. That's the PCS patients, the PCS caregivers, the suspected CTE caregivers, and this is suspected CTE patients. We also have a concussed moms Zoom group, and then we also have our Canadian Zoom groups. If you haven't already, please schedule a one-on-one with me. You can look for that link to schedule that with me in the follow-up email. And it's just for me to get to know you. If you guys have already scheduled that and we've already had our meeting, that's great. If we haven't, it'll just give me a chance to check in with you, see how you're doing, and see if you need anything or if you have any questions for me. So after this meeting, I'm going to follow up with an email that has our Facebook group links, our Zoom group links, and then the training recording link, and then our guidebook, which consists of our PCS caregiver and our suspected CTE caregivers. So as we jump into our training topic, a question that we can keep in our head is, how can we as peer support volunteers ask questions to help mentees see a path forward? My background is in behavioral and mental health, and a lot of times I've worked with parents in training and how to, set goals or see a path forward for their little ones who have autism. And a lot of times the questions that I would ask would spark new ideas or pathways that they would in turn ask me if there's a possibility. And them setting their own goals and having the motivation, I saw a lot more progress and a lot of encouragement between parents and the child and the whole process. So if we could just keep that question in our head during the training, it would be very helpful. So let's jump in. What is motivational interviewing? Motivational interviewing is a counseling technique used to help people find the motivation to make a positive behavioral change. It is a client-centered approach and useful for people who have difficulty changing or afraid to change behavior. This technique was developed to help people take control of their own recovery process as much as they're able to. I can't speak for everyone, but I know the recovery process isn't 100% in our control, and there are so many different factors that we have to look at. For the spirit of motivational interviewing, there are 3 things that we want to pay attention to. Collaboration is a partnership where individuals work together. In motivational interviewing, the relationship is based on the views of the experiences of the client. Collaboration builds rapport and trust, so we want collaboration instead of confrontation. Motivation to change comes from within. Drawing out a person's ideas and true motivation comes from listening and responding, not educating. So we use evocation rather than education. And lastly, we're not authority figures, but instead peer support. Demands from us just don't work. We can share our own experiences and let motivation to change come from our genuine support. So we try to have autonomy over authority. These are the 4 main principles of motivational interviewing. So many don't seek out help for fear of being judged. We offer a judgmental, free zone, and it's exactly what motivational interviewing pushes for. We offer support from a place of empathy. A goal of motivational interviewing is to help the individual realize the mismatch between where they are and where they want to be. That's when true motivation can change and grow. So we try to develop discrepancy so that way we can see how far we have to go and, the motivation to grow in that area. Change doesn't always happen the way you want it to, or in the time frame you may have had in mind. Being able to roll with that truth is incredibly important so as to not decrease motivation. You can help your mentee during these times by reframing or offering different interpretations of a certain situation or outlook, and really just roll with that resistance. And lastly, we want to increase the belief and confidence of our mentees, having themselves and their abilities. Make sure to offer recognition and encouragement often. That way we can build and support self-efficacy. Some techniques in order to achieve these goals are these 4 right here. The first one is open-ended questions. These are questions that you can't answer a simple yes or no to. These questions encourage thinking more deeply. An example of this would be, what's something you're proud of accomplishing? Affirmations are statements that recognize a person's strengths and acknowledge their positive behaviors. An example of this would be, you handled that situation very well, or I appreciate the courage it took you to try something new. Reflective listening is perhaps the most crucial during motivational interviewing. It shows that you're listening to what the mentee is saying. It shows you understand what they're saying and are empathetic to their words and feelings. And lastly, we have summaries. Summaries are a special type of reflection. There are 3. We have collecting. Let me see if I understand what you have said thus far. We have linking. A minute ago, you said you wanted to blank. Maybe now we can talk about how to try and blank. And transitioning. A minute ago, you said blank, but the last time we met, it seemed like blank. What do you think about that? Summaries also help narrow in on a specific point someone has made or is making. The benefits of motivational interviewing. We get the chance to help mentees build self-confidence and trust in themselves. We get to help mentees take responsibility for themselves and their own actions. We get to prepare mentees to become more receptive to treatment, and we get to show mentees that they have the power to change their lives themselves. So at this time, we're going to jump into our breakout rooms. I'm going to send you guys a link in the chat to be able to have just a 1-page note on what we've gone over. It'll have keywords in there that you can look at during the discussion and as well when we play Jeopardy. So during that time, take turns asking each other motivational interviewing questions. They can be real or fake, but just make sure that you take turns asked and being asked.